Are there any differences in coronary artery diseases between men and women with regard to endothelin?
Yes, they are, and actually with regards to coronary artery disease in general, we're talking about macrovascular coronary artery disease, from which women before menopause are protected because of the production of endogenous estrogens. And the other thing is that women are much more prone to develop microvascular coronary artery disease and symptoms, and that this onset of the symptoms often coincides with menopause or a little bit before menopause, and it's very difficult to treat, and patients can be highly symptomatic.
What new evidence do we have about the link between coronary diseases and endothelium system?
Well, we know that all known risk factors are activators of the endothelin system and stimulate its production. So if we treat risk factors, say hyperlipidemia with a drug or arterial hypertension with a drug that brings down those conditions, we will have a reduction in endothelin. And there's also accumulating genetic evidence that endothelin plays a role in conditions that, again, are found mostly in women between 47 and 53 years of age, suggesting, again, a role of sex hormones in this condition. It's a condition called spontaneous coronary artery dissection, and it causes an intimal rupture with bleeding into the vascular wall. And there are currently no treatments, and there are no ways to predict such an event, and there often are recurrences.
Are there any clinical studies that shows benefits in blocking endothelin receptors in coronary artery diseases?
Yes, there are several studies. Studies have shown that acutely, when you see patients with myocardial infarction and you treat them acutely with an endothelin antagonist, you will improve coronary blood flow. But there are also studies, long-term studies, that indicate that there is an improvement of coronary blood flow after 6 months of treatment, and a reduction of plaque buildup in the coronary circulation. This concerns macrovascular disease, but there's also microvascular disease where we don't have the studies yet, but these studies are ongoing. And the exciting thing about these studies is that this will also take into account the genetic makeup of the patients with regard to the endothelin system and its mediators and its receptors. And this may ultimately provide a new way of personalized medicine in a condition, microvascular angina, where we currently don't really have any drugs.